Invoking blessings of the Almighty and offering our respects to Sadhguru Sri Madhusudan Sai, elders and guests, brothers and sisters seated here, and everyone joining us live, Sai Ram, Namaste, and a very good morning. At the outset, a warm welcome to all dignitaries on stage. Dr. Sharan Prakash Patilji, Honorable Minister for Medical Education and Skill Development, Government of Karnataka. Mr. Sunil Kumar Dhareshwar, Trustee, Infosys Foundation. Shri B.N. Narsimurthy, Chief Mentor, Shri Sathya Sai Lok Seva Gurukulam Group of Institutions. From the senior management of Sri Madhusudan Sai Institute of Medical Sciences and Research, we have Director Medical Education, Dr. A.R. Raghupati. And our revered founder and CEO, Sadhguru Sri Madhusudan Sai. We will commence the program with invocation by Vatus of our Veda Gurukulam. They will chant verses of Lokashirvada.
ज्ञानदानाय विद्महे सत्यरूपाय धीमहि तन्नो मधुसूदनः प्रचोदयात् त्र्यम्बकं यजामहे सुगन्धिं पुष्टिवर्धनम् उर्वारुकमिव बन्धनान् मृत्योर्मुक्षीयमामृतात् कद्रुद्राय प्रचेतसे मेधुष्टामाय तव्यासे वोचे मशन्तामं हृदे नवो नवो भवति जायामानोऽह्नाङ्केतुरुषसा मेत्यग्रम् भागं देवेभ्यो विदादात्यायन् प्रचन्द्रमा स्थिरते दीर्घमायुः पर्याप्त्या अनन्तरायाय सर्वस्तोमोतिरात्रमुत्तममहर्भवति सर्वस्याप्त्यै सर्वस्य जित्यै सर्वमेव तेनाप्नोति सर्वं जयति वासुदेवाय विद्महे वैद्यनाथाय धीमहि तन्नो धन्वन्तरिः प्रचोदयात् हरिः ओम्।
Sadhguru Sri Madhusudan Sai firmly believes that quality education, healthcare, and nutrition are the fundamental rights of every human being. Therefore, all our services rendered completely free of charge focus on these three verticals. Headquartered in Sathya Sai Grama, our mission today has expanded to serve our brothers and sisters not only in India, but in more than 80 countries across the globe. We have a video showcasing our work and mission. May we have the video, please?
One world, one family is the ethos at the heart of our mission. This ideal comes from an ancient Indian principle which considers the whole world as one global family. And as a family, we believe all our family members deserve care and support. Across the globe, we serve millions through three pillars: nutrition, education, and healthcare, all completely free of charge. The Annapurna Morning Nutrition Program began in 2012, providing breakfast for just 50 children, and has since grown to become India's largest morning nutrition program. Today, millions of school children across India and beyond receive the Sai Shore multi-nutrient supplement, helping them begin each day nourished and ready to learn. At our mission, we believe education is every human being's birthright. With a global presence and multiple campuses throughout India, we provide free education from grade 6 to doctorate studies, ensuring every student receives a well-rounded, values-based education that combines high-quality academics with moral and spiritual values. The Sri Sathya Sai University for Human Excellence opens doors previously unimaginable to children from underserved communities. by offering quality higher education to those traditionally overlooked, and with a strong emphasis on empowering women, we're breaking the cycle of educational disparity and promoting gender equality in education. Meanwhile, our Skill Development Center equips rural youth with job-ready skills, and our scholarship program supports education with thousands of rural children. Our commitment to empowerment is also demonstrated by People Shores, an impact sourcing organization in the United States. We help youth from marginalized communities gain skills for the digital economy. This innovative model delivers high-valued business services while transforming lives and uplifting communities. Our vision for accessible medical education became a reality in 2023 when Prime Minister Shri Narendra Modi inaugurated the Shri Madhusudan Sai Institute of Medical Sciences and Research, India's first free, private, rural medical college. This institution aims to nurture noble-minded healthcare professionals who are dedicated to serving the underserved members of our society. Our healthcare mission goes beyond treating illness. We're pioneering solutions to bridge critical gaps in accessible medical care, and through our network of wellness centers, mobile hospitals, and multi-specialty facilities, we bring free healthcare directly to underserved rural communities. From preventative care to complex surgeries, at our hospitals, there are no billing counters. Since 2016, we've expanded beyond India to serve communities across the globe with the singular goal of leaving no person behind. Exemplifying this idea, our Sri Sathya Sai Sanjeevani centers form the world's largest chain of free pediatric cardiac hospitals, giving new life to children with heart defects. And with continually growing needs worldwide, we're expanding our healthcare facilities with the world's largest free hospital. Our 600-bed facility that demonstrates our dedication to accessible healthcare for all. Our vision is clear. A society where life's value is measured not in wealth, but in compassionate service to those in need. And this vision only becomes a reality with the contribution and generous support of our global family. After all, we are all one world, one family.
With a population of 1.46 billion and growing, there is a widening gap to accessible healthcare services, particularly in secondary and tertiary care and especially in rural areas. This, coupled with demographic shifts like an increasing elderly population, lifestyle and non-communicable diseases, places greater demand on healthcare services. A sustainable solution to this would be the 3S model advocated by Sadhguru, which is a collaboration between Sarkara, Samaja, and Sansthan. Today's event is a testimony to this very idea, as we have our Honorable Minister from the Sarkara, Samaja represented by the Infosys Foundation, and an institution such as ours, all in congruence. Shri Madhusudan Sai Institute of Medical Sciences and Research is our collective endeavor that has been tirelessly striving to achieve global standards of excellence both in medical education and clinical services. I request Dr. Satish Babu, Director, Academics and Strategic Growth, to make the introductory remarks. An alumnus of this very institution, he is a leading diabetologist and endocrinologist. Dr. Satish Babu, please.
Good morning and Sairam to all of you, offering our collective salutations at our beloved Sadhguru, distinguished, respected guests of honor on the stage, elders, faculty, and my dear students. Today is a day of celebration, gratitude celebration. To put this into context, I thought there are two facts which we need to understand. There is as Dr. Sai Lakshmi mentioned, there is a crisis happening in the rural India, and this is 2017 Niti Aayog report quoting, or the study suggested that 60 million people every year are pushed to poverty because of medical expenses, especially out-of-pocket expenses and catastrophic spending. And this was reviewed again in 2022 by WHO, and marginally, only from 60 million to 55 million was the drop. So this is what the reality is, what we are, and it is by the day getting worse. So on the other side, medical education, we are expanding medical colleges, but for last 2 to 3 decades, it is becoming very expensive and elitist. And driving this into urban-centric. So poor and rural deserving students are left over. The opportunity is lost to them. So both these are intertwined and interlinked strongly, and one solution what our beloved visionary leader Sadhguru gave was, from the inspiration of Bhagwan Baba, free medical health care, took to next level of making medical education, health education free of cost. So that sort of equalized or brought parity, especially in the rural, for the children of rural and economically weaker section. And he also powered with empathy and women values as formative education, as a formal education. That's what the genesis of this Sri Madhusudan Sai Medical College is, and all the NMC regulatory requirements of both departments and facilities are met, and we know what's the impact it's already doing in the region. So we have crossed 1 million outpatients, and we have crossed almost 30,000 surgeries and interventions. So as Dr. Sai Lakshmi mentioned, the model is Sarkar, Samaj and Samstha. And I had an opportunity with blessings of Sadhguru to interact with Dr. Sharan Patil multiple times with our issues. And always, I should put it on record, he listened to our issues and gave a solution and gave all the encouragement for the medical college. As soon as the medical college was started, he became medical education minister, and multiple times we have represented with our issues and our challenges. He's been such a supportive minister and such a supportive individual as a person to the institution. So coming to society, Infosys Foundation came with a very big heart and gave a big grant, which became a boon for this region. This hospital is now equipped with state-of-the-art equipments. Almost 50 equipments were provided, and again, it's a record. You can say all the equipment are in par or above, a notch above best equipment which you find in the best centers anywhere in India. So this support of Sarkar, this support of Samaj as a foundation, Infosys Foundation, which has provided, is touching millions, thousands of our rural deserving patients, and it is going to benefit a lot. So I'll conclude by saying that there is an ecosystem here created by our visionary leader, Sadhguru, beloved Sadhguru. There are trained, talented, motivated, competent individuals in this comprehensive healthcare system, providing primary, secondary, and tertiary healthcare. on top of it, with the support of government and institutions, foundations like Infosys, the quality has gone notch above, and bringing it to the world standards. There are best evidence-based practices. Technology and training go hand in hand. So the training and upskilling our undergraduate, postgraduate and paramedical students is very important. That adds to as a capacity building to the nation. And these equipments again make a big impact, big training at the formative, at the training level itself. And of course, it is also adding to centers of excellence, like we have already started the process to start advanced fetal center, which will be again a boon for all of South India, if not only to the region, because it's a new niche specialty and upcoming specialty, making intrauterine diagnosis and treatment of congenital diseases quite early, in fact up to in utero itself. And the whole ecosystem, as I mentioned, it's not only about giving medical education, it's not only about giving clinical caseload, it's about what is the molding, how the students are nurtured. That's again makes a big difference in this institution. They're made to be individuals of character with commitment, so that they go out to rural areas to serve the deserving people. And of course, the visionary leader, our beloved Sadhguru, is always thinking of tomorrow. Research, innovation, artificial intelligence is a big push. We are going to start Genomic Center very soon. And of course, another big thrust, what the organization is giving, is Made in India concept, so that all the consumables, all the equipment at some stage has to be made in India. Common man, cost of healthcare, cost of medical care should come down, and this is one of the way forward, is what he preaches. And already the process has initiated. Heart-lung machine is being made by our organization with the Indian Institute of Madras. So these are what I wanted to put forth to both our Honorable Minister and Foundation, so that we have a long-term partnership to go to higher standards, serve more, touch more individuals, is what our sincere prayer is. With this, I conclude again offering our gratitude to both our Honorable Minister and Mr. Sunil Kumar Dareshwar for being with us and supporting us all through. Thank you.
Thank you, sir. As pointed out by Dr. Satish Babu, thousands of patients receive quality treatment at our hospital each day. And for us, every single patient is important because every life matters. Therefore, it has been our tradition to celebrate their recovery when they are blessed with a new lease of life. This morning, we have two such beneficiaries. First, we have 3-year-old Yellalinga from Raichur. He was diagnosed with ventricular septal defect and PDA. His father, Amaresh, is a farmer earning less than 10,000 a month and could not dream of affording surgery. We request Yellalinga and his father to please come on stage. It was only a stroke of luck that brought them here, and today, after their son has been successfully operated upon for VSD closure with PDA ligation, their fear has turned to faith as they return home with renewed hope and a better future for their son. Next, we have 20-year-old Archana. She was not only anemic, but also developed hypertension in her third trimester. She had to undergo an emergency C-section because of preeclampsia and retarded fetal growth. After nearly 10 days of closely monitored post-operative care, both baby and mother are now recovering steadily. Our collective prayers and best wishes to all patients and their families. We are extremely grateful to the Infosys Foundation for making these miracles possible, and we are proud to partner with them in our shared endeavor to make healthcare affordable, accessible, and available to every last patient in need. We are honored and pleased to share that the scope of our expanding services now includes state-of-the-art MRI and ultrasound facilities, specialized mother and child health, critical care through neonatal and pediatric intensive care units, and advanced cardiac care. Today, we offer these in service of our fellow men with the idea that the whole world is our family. We will now have a short video on the reach and impact of this collaboration. Can we have the video, please?
ಈ ಬೇಬಿಗೆ ಸ್ವಲ್ಪ ಪ್ರಾಬ್ಲಮ್ ಆಯ್ತು 5 ದಿನ ಆದಮೇಲೆ ಒಂಥರ ಪಿಡ್ಸ್ ಥರ ಬಂದಿತ್ತು. ಅದಕ್ಕೆ ತಗೊಂಬಂದು NICಗೆ ಶಿಫ್ಟ್ ಮಾಡಿಕೊಂಡ್ರು ಡಾಕ್ಟ್ರು. 11 ದಿನ ಅಬ್ಸರ್ವೇಷನಲ್ಲಿಟ್ಟರು. ಎಲ್ಲ ನಾರ್ಮಲ್ ಇದೆ ಇವಾಗ, ಎಲ್ಲ ಪರವಾಗಿಲ್ಲ ಅಂದಿದ್ದಕ್ಕೆ ನಿನ್ನೆ ನನಗೆ ಕೈ ಕೊಟ್ಟಿದ್ದಾರೆ.
ನಮ್ಗೆ ಒಬ್ರು ಹೇಳಿದ್ರು ಈ ಥರ ಹಾಸ್ಪಿಟ್ಲ್ ಐತೆ ಮುದ್ದೇನಹಳ್ಳಿಯಲ್ಲೇ ಅಂತ. ಇಲ್ಲಿ ಬಂದಮೇಲೆ ಆಪ್ರೇಷನ್ ಮಾಡ್ತೀವಿ ಅಂತ ಹೇಳಿದ್ರು. ಅಲ್ಲಿ ಸಕ್ಸಸ್ ಆಯಿತು. ನಮ್ಮ ಹುಡುಗಿ ಚೆನ್ನಾಗಿದ್ದಾರೆ.
Routine antenatal scans are a lifeline for monitoring fetal growth and health, which are either out of reach or too expensive for such patients. Thanks to Infosys, now we have obtained state-of-the-art ultrasound machines in our very own institute, which help us capture diagnostic quality high-resolution ultrasound images, which makes fetal and maternal care affordable and possible.
Before the arrival of these imaging technologies, many rural patients had to travel over 70 to 100 kilometers to access MRI or quality ultrasound services, often delaying diagnosis due to financial or logistical constraints. For our BSc Imaging Technology students and radiology residents, the high-end machines have become dynamic classrooms. These young technologists and residents now receive daily hands-on training in handling sophisticated GE consoles, Doppler studies, and MRI consoles, learning directly on machines they would otherwise only see in corporate hospitals. On behalf of every patient whose pain was understood better, every student who learned smarter, and every researcher who dreamed bolder, thank you.
Thank you. We invite Mr. Sunil Kumar Dhareshwar to say a few words. He is the Executive Vice President, Finance at Infosys, the Global CFO for Consulting Products and Platform Business, Global Head for Infrastructure, Facilities and Physical Security. Mr. Dhareshwar, please.
Namaskara, good morning. Sadhguru Shri Madhusudan Sai, Dr. Sharan Prakash Rudrappa Patil, Honorable Minister for Medical Education and Skill Development, Mr. B.N. Narasimhamurthy, Dr. Raghupati A.R., and Dr. Satish Babu. Dr. Satish Babu has been in constant touch with me right through this entire project from its initiation till today, trying to ensure that all of us come here together, getting all of our logistics and calendars. Thank you very much, Dr. Satish Babu, for all of your efforts and spearheading this entire program and the project right from its initiation. Ladies and gentlemen and distinguished guests, we are gathered here to celebrate an endeavor that underscores our unwavering commitment to nurturing the health and well-being of mothers and children who are the very foundation of our future. Our collaboration with Prashanti Balamandira Trust underscores Infosys Foundation's steadfast commitment to bridging healthcare and disparities and ensuring equitable access to critical medical services for underserved communities. Through our support for Sri Sathya Sai Memorial, Sarla Memorial Hospital, we aim to provide free specialized care for women and children and provide long-term, high-quality healthcare to marginalized sections of society. In every society, the health of mothers and their children is a cornerstone of progress and prosperity. When mothers are healthy and children receive the care they need, entire communities thrive. This grant symbolizes our collective determination to ensure that every mother, regardless of her circumstances, has access to exceptional health care and that every child is given the opportunity to grow, flourish, and achieve their true potential. By channeling resources into maternal and child health care, we are investing in preventive care, timely interventions, and comprehensive support systems that will make a tangible difference in the lives of many. Maternal health is a critical aspect of our healthcare system, and this grant will enable us to take significant strides in enhancing the services available to expectant and new mothers. The health and well-being of children are paramount to the future of our society. This grant will support initiatives aimed at improving pediatric care through infancy. The funding has been used to procure advanced medical equipment for obstetrics and gynecology, as well as to enhance medical facilities of the neonatal intensive care unit, the pediatric intensive care unit, diagnostic radiology, and operation theaters. This initiative is expected to benefit over 8,000 individuals annually by ensuring timely medical interventions and specialized care absolutely free of charge. The hospital, being a teaching institution, the added equipment will enable training and upskilling the doctors, both undergraduate and postgraduate, and also nursing and allied healthcare trainees, in turn contributing to capacity building in the healthcare services. The ripple effects of this grant will be felt far and wide. When mothers and children are healthy, families are stronger, and communities are more resilient. Improved maternal and child health care will reduce the incidence of preventable diseases, lower mortality rates, and enhance the quality of life for many. It will alleviate the economic burden on families by reducing healthcare costs and minimizing the long-term impact of health issues. This grant will also empower our dedicated healthcare providers who work tirelessly to care for mothers and children. By providing them with the resources they need, we are ensuring that they continue to deliver exceptional care. As we embark on this journey to enhance maternal and child health care, let us remember that every effort we make is an investment in the future. By supporting mothers and children, we are laying the groundwork for a healthier, happier, and more prosperous society. This grant is a testament to our collective vision and determination to make a meaningful impact. I'd like to thank our teams, the Infosys Foundation team, Manisha Sabu and Sapna Nair, also our health, our procurement team, Balasubramaniam and his team, for the support that they've provided in this project from its initiation to completion. Let us continue to work hand in hand, forging a path towards a brighter future for mothers, children, and our entire community. Thank you very much.
Thank you, sir. May we now request our Honorable Minister, Dr. Sharan Prakash Ji, to address us. A dermatologist by profession, he has been a 3-term MLA representing Sedam constituency of Kalburgi district. He is also the minister in charge of Raichur district.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಇಂದಿನ ಈ ಸಮಾರಂಭದ ಸಾನ್ನಿಧ್ಯವನ್ನು ವಹಿಸಿಕೊಂಡಿರ್ತಕ್ಕಂಥ ಪರಮಪೂಜ್ಯ ಸದ್ಗುರು ಮಧುಸೂದನ್ ಸಾಯಿಯವರಲ್ಲಿ ವಂದಿಸಿ, ಇಂದಿನ ಈ ಸಮಾರಂಭದಲ್ಲಿ ಉಪಸ್ಥಿತಕ್ಕಂಥ ಸುನಿಲ್ ಕುಮಾರ್ ಧಾರೇಶ್ವರ್ ಅವರೇ, ನರಸಿಂಹಮೂರ್ತಿಜಿಯವರೇ, ಡಾಕ್ಟರ್ ರಘುಪತಿ ಅವರೇ, ಡಾಕ್ಟರ್ ಸತೀಶ್ ಅವರೇ ಮತ್ತು ಈ ಸಮಾರಂಭದಲ್ಲಿ ಉಪಸ್ಥಿತಕ್ಕಂಥ ಎಲ್ಲ ಆತ್ಮೀಯ ಬಂಧುಗಳೇ ಮತ್ತು ಇಲ್ಲಿರ್ತಕ್ಕಂಥ ಎಲ್ಲ ನನ್ನ ತಾಯಂದಿರೇ, ಇವತ್ತು ಪ್ರಶಾಂತಿ ಬಾಲಮಂದಿರ ಟ್ರಸ್ಟ್ ಮತ್ತು ಇನ್ಫೋಸಿಸ್ ಫೌಂಡೇಶನ್ ಇಲ್ಲಿರ್ತಕ್ಕಂಥ ಸರಳ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ತಾಯಿ ಮಗು ಆಸ್ಪತ್ರೆಗೆ ಮತ್ತು MRI ಮತ್ತು ವಿವಿಧ ಉಪಕರಣಗಳನ್ನು ಇಲ್ಲಿ ಕೊಡೋದ್ರ ಮುಖಾಂತರ ಈ ಭಾಗದಲ್ಲಿ ಬರ್ತಕ್ಕಂಥ ಅನೇಕ ಚಿಕಿತ್ಸೆಗಾಗಿ ಬರ್ತಕ್ಕಂಥ ಬಡವರಿಗೆ ಒಂದು ಭಾಳ ದೊಡ್ಡ ಕೊಡುಗೆಯಾಗಿದೆ. ಹಾಗಾಗಿ ನಾನು ಇನ್ಫೋಸಿಸ್ ಟ್ರಸ್ಟ್ನ ಸುನಿಲ್ ಕುಮಾರ್ ಅವ್ರಿಗೆ ಮತ್ತು ಇನ್ಫೋಸಿಸ್ ಫೌಂಡೇಶನ್ಗೆ ಧನ್ಯವಾದಗಳನ್ನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ. ವಿಶೇಷವಾಗಿ ಸದ್ಗುರುಗಳು ವಿಶ್ವದಾದ್ಯಂತ ಅನೇಕ ಆಸ್ಪತ್ರೆಗಳನ್ನು ಕಟ್ಟೋದ್ರ ಮುಖಾಂತರ, ವಿದ್ಯಾಸಂಸ್ಥೆಗಳನ್ನು ಕಟ್ಟೋದ್ರ ಮುಖಾಂತರ ಸಮಾಜದಲ್ಲಿರ್ತಕ್ಕಂಥ ಕಟ್ಟಕಡೆಯ ಮನುಷ್ಯನಿಗೂ ಕೂಡ ಒಳ್ಳೆಯ ಅವರಿಗೆ ಶಿಕ್ಷಣ ಸಿಗಬೇಕು ಮತ್ತು ಎಲ್ಲರಿಗೂ ಕೂಡ ಒಂದು ಆರೋಗ್ಯದ ವ್ಯವಸ್ಥೆ ಉಚಿತವಾಗಿ ಸಿಗಬೇಕು ಅಂತಕ್ಕಂಥ ಒಂದು ಸದುದ್ದೇಶದಿಂದ ಈ ಒಂದು ಅನೇಕ ಜನಪರವಾಗಿರ್ತಕ್ಕಂಥ ಯೋಜನೆಗಳನ್ನು ಹಮ್ಮಿಕೊಂಡು ಇವತ್ತು ಜನಸೇವೆ ಮಾಡ್ತಾ ಇರ್ತಕ್ಕಂಥದ್ದು ಇದು ಶ್ಲಾಘನೀಯ. ಸರ್ಕಾರಗಳು ಮಾಡಬೇಕಾಗಿರ್ತಕ್ಕಂಥ ಕೆಲಸ ಸದ್ಗುರುಗಳು ಮಾಡ್ತಾಯಿದ್ದಾರೆ. ಅವ್ರಿಗೆ ನಾವು ಅಭಿನಂದನೆಯನ್ನು ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೀವಿ. It is very important for a country like us, where we need to take care of the larger sections of the population which is underprivileged. In Karnataka, my government has been having a vision to establish best of the health facility, especially in the rural areas. In this endeavor, we have established many government medical colleges. Probably in the country, Karnataka has the highest number of medical seats. Though we are second in number of colleges, Tamil Nadu being the state with the highest number of medical colleges, 73 medical colleges, and Karnataka is the second with the 70 medical colleges, both in private and government sector. We have around 24 government medical colleges in Karnataka, and the vision of the government is to establish one government college in each district with an intention of helping the meritorious students of the state. And also, by establishing a teaching hospital under the medical college, it will serve the underprivileged in the entire district. And even establishing super specialty hospitals at all the divisional headquarters. We have a plan for the government, and the Honorable Chief Minister has also unveiled a roadmap where we have planned in coming 5 years, we want to establish one government medical colleges in each district with a super specialty hospital, with a trauma care facility, and as well cancer hospital as well. And we have been able to successfully do so in 12 of the districts as of now. And also, we have been establishing Jaideva Institute of Cardiology in Mysore, in Kalburgi, and also we are going to inaugurate one in another 8 months in Hubli as well. The intention is we want to establish these public institutes so that there will be a balancing out of the facility whenever a private hospital or a corporate hospital is built. And also, people who can afford can avail their services there. But the people who are in the middle class and the lower middle class, we need to give them the same facility which is there in the best of the hospital. That's what Sadhguruji is trying to do, and it's very important. So that's a great commendable job. So government is also trying to establish a benchmark, establishing hospitals and the government sector. The intention is we should act as a one leveling field so that we will monitor the costs. You can imagine if Jaideva was not there today, probably the cost of the stent would have been 3 lakhs. Now it is 60,000 because Jaideva is doing at that cost. So we need to keep a check on the growing cost as well, because this growth cannot be a growth which is not inclusive. Hence, government is trying to establish these public institutes like super specialty hospitals in the rural area so that we can keep a check on the cost for the future. So also I am requesting all the corporates in the country to invest in this hospital so that even the underprivileged and the last man will also have a better quality treatment. So I think we need to focus on this. And for this, always it has been a tradition of our land where Dasoha is considered to be one of the most important aspects of our life. Giving to others will bring us joy. That is a concept Babaji has also propagated, and our Baswadi Sharanas has also propagated that Kayaka Dasoha is our Samskriti. ಸಕಲ ಜೀವಾತ್ಮಗಳಿಗೆ ಲೆಸನ್ನು ಬಯಸಿರ್ತಕ್ಕಂಥ ಬಸವಾದಿ ಶರಣರ ತತ್ವ ಕೂಡ ಅದೇ ಆಗಿರೋದ್ರಿಂದ ವಿ ಆಲ್ಸೋ ಹ್ಯಾವ್ ಟು ಡೆಡಿಕೇಟ್ ಅವರ್ ಲೈಫ್ಸ್ ಫಾರ್ ಅಪ್ಲಿಫ್ಟ್ಮೆಂಟ್ ಆ್ಯಂಡ್ ಆಲ್ಸೋ ಫಾರ್ ದ ವೆಲ್ಫೇರ್ ಆಫ್ ಎವ್ರಿಬಡಿ ಇನ್ ದಿಸ್ ಸೊಸೈಟಿ. ಥ್ಯಾಂಕ್ ಯು.
Thank you, sir, for your kind words and for gracing this momentous occasion despite your busy schedule. A token of our gratitude to you, sir. Also, our gratitude to Mr. Dhareshwar ji. We look forward to a continued and lasting partnership. On behalf of everyone, we pray to Sadhguru to bless us with his divine message.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखम् आप्नुयात्. I often quote this prayer because it prays for the welfare of all. Sarve. This is Indian culture, this is our philosophy, where we include everyone and exclude none. And this mission, which is about one world, one family, and leaving no person behind, it's about doing this every day, every hour, every minute of our life. But we can't do it all alone, all by ourselves. And that is where we need partnerships. And when we look at the Sustainable Development Goals of the United Nations, one of the goals is partnerships for change. I think this is a perfect example of a tripartite partnership between the Sarkara, Samaj and Samstha, which has been already spoken about. The coming together of these three can transform everything in the society: education, healthcare, nutrition, or any other basic societal needs. So on this very special occasion, I am truly privileged to express our gratitude on behalf of the entire institution to both the dignitaries on the stage, Dr. Sharan Prakash Patil, who has been a pillar of support in helping us establish the medical school and get us whatever other requirements that we have had from the government side. He has been very forthcoming, very supportive, and today whatever he has spoken and encouraging all of us to work together is the way forward, I truly believe, and we want to continue this partnership with the government of Karnataka and continue to spread good health and education to the needy students. So our personal gratitude as well as the gratitude from the institution to you, sir. Of course, this occasion is because Infosys Foundation exists, it's because Sunil Kumar Dareshwar exists, and it's because his whole team exists to make such good things happen in the world. We started alone on this journey in this little hamlet with a simple mother and child hospital. That was the envisioned idea, but then we realized the need of the place and the country, and medical education got added. With that came the demand for better equipment, better training facilities, better treatment facilities. And we always were looking for partners who could help us with that. And today, Infosys Foundation, through you and your team, has truly given us a shot in our arms. We have felt much more empowered, more capable, more encouraged to do the work that we have embarked to do. And as I said, this is a partnership. We are all people with one wing, I always say. We are one-winged angels. And we need another angel with another wing to fly. And this partnership is going to definitely take the mission of equitable, accessible, affordable healthcare to the last and the least in a more accelerated way. As we walked around the hospital, you did see how these equipment are also helping the next generation of doctors to be the nurses, the paramedics, the technicians, to learn new skills. And that's extremely important. At some point in time when I was with the Honorable Prime Minister, he mentioned that one of the problems of the country is skills. And even during COVID time, we saw there were hundreds and thousands of equipment donated to various hospitals like oxygen generators or concentrators. Many of them remain unopened. The boxes never got opened because there were no technicians to help with them. And that is where skill development or building capacities in the new generation is extremely important. Recently, a survey came out which said that we are 1.46 billion people, 146 crore people now. And in another 30 years, we'll be 170 crores people before our population starts declining. In another 20 years or 30 years, we are going to add at least 30 to 40 crore young people. These are children who will be born in rural hospitals, not in urban setup. These are mothers who would be laboring toiling in the fields in rural areas, not in corporate setups. These are the people who need all the help. And we see this all the time from the rural point of view. The women are anemic, women are malnourished. They are very ill-educated about how they should look after themselves, pre- and post-deliveries. Then there are complications and the children are born with their preterm babies and their congenital issues. And all these needs to be handled at a lightning speed if we want the next 30, 40 crore of people of our country, workforce, to be healthy and capable. So this is an investment, and I like the word when you said this effort is an investment. Definitely anything done for the society is not an expense. In our institution also, for the sake of accounting, we do have one side of income and other side is expenditure. But for me, everything is an investment. Whatever money has been spent, energy, time and effort is an investment in the future of our children, our country and the world. And to me, the cause of mother and child is very dear because we all have been born through some mother. We know the pain that they undergo to give us a life and look after us, nourish us, nurture us, grow us, the sacrifices that they make. And when that most important citizen of the country, the mother, does not get her due care and attention and health, I think it's a great tragedy as a society. So we are trying to do that what we can. Government is making great efforts. We work with the government, we work with the ASHA workers, we work with government hospitals, and they also help us understand the problems at the grassroots level and help us solve those. So this is a definitely a partnership that will be transformative for the country. And as we make efforts to further the cause of equitable healthcare and also healthcare education, because they both have to come together. What's the point in having equipment without having technicians or skilled workforce to look after it, to take care of it, to use it? So both are happening. It's two birds with the same stone is what I was mentioning to him. So while as Infosys Foundation, you might have thought we are just going to equip a hospital, but you are actually incidentally or accidentally ended up training the next generation of healthcare professionals on the sidelines. So this is the double benefit of working with an institution which is teaching and training. Once again, there is paucity of time, and I'm very glad that despite the cabinet meeting which was shifted from Nandi Hills to Bangalore, Dr. Patil made it here to be with us and to celebrate this occasion. And also, of course, Sunilji, he came earlier than scheduled to be with us, and he has to go back even farther than Dr. Patil. He has to cross Vidhan Soda and go to Electronic City. So you can only imagine his day, what it's going to look like. All the very best to you for your journey back to your office. But having come to this side of the town and done this for the people, that is something that is commendable. And I'm sure in times to come, we look forward to a lasting partnership in furthering this cause of equitable healthcare and education, especially to the rural masses. It will be always the best, but for the last also. And that would be the motto of our work together. I thank the faculty, the team, the hospital team, as well as all the medical students who are benefiting from this. Please do remember, you are standing on many shoulders. And these are the shoulders that you stand on. Never forget that when you are in that position where you can help others, remember and express your gratitude through your service to the poor, to the needy, to the deserving. With these words of gratitude, praying for everybody's health and welfare, I conclude. Thank you.
Thank you, Sadhguru. Once again, our collective gratitude to Dr. Patilji for joining us today, Mr. Sunil Kumar Dhareshwarji, the Infosys Foundation, and everyone who has worked towards making this possible. With this, we conclude the event. Thank you. Have a good day.